Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Well, hello everybody and welcome to another edition of our podcast, and today I've got with me Dr. Sandy Dinsdale from New Zealand, and she's going to be giving me a little bit of a story and also too asking any questions that she wants. It's just a free form chat. So first of all, Sandy, hello and welcome.
Thank you.
And if you can just maybe tell us your story and what drew you from general practice into homeopathy originally?
Well, my story starts very early in my general practice career. Within the first couple of years, I had a patient that I was treating who had extraordinarily effective and rapid wound healing from a surgical removal on her foot. And I knew that I was looking at something remarkable because it happened within 7 days instead of the usual 10 to 14.
So that's interesting too, because you've got that training that lets you know what you're going to expect. So you're able to judge the effectiveness of homeopathy by what you can see as a normal healing time by comparison, and then seeing that this was a lot more rapid.
Yes, in fact, the nurse called me into the treatment room to show me.
Is that right?
So the person came for a dressing with the nurse, but the nurse was so surprised she invited me to come and have a look, and of course I just said to the patient, "Wow, that's amazing! What did you do? How have you done that?" And she told me. She said, "I've been using homeopathy." And I said, "Well, what's homeopathy?" And she told me.
So what did you do next? What was the next step? So that was the first wow. Where did that lead to?
Well, she had been training at a local training college, so she mentioned that to me. And I suppose being a busy young GP, trying to learn all the ropes and everything, and my first, long-term position, I pretty much shelved it for a few years. I did use some bark flower remedies that she'd suggested were useful, and it was probably maybe 2 to 3 years later that I was in a rest home setting, seeing older patients, and then one of the nurses said to me that they were using homeopathy, and so suddenly I was like, "Oh yeah, I've heard of homeopathy." So it was like it tweaked the memory, and that nurse had been studying at the local college, and so that's when I had a bit more space and time to look into it. And as soon as I realised it was something I could study part-time while I was still working as a GP, I decided I needed to do it, because that memory of witnessing something beyond normal was still with me, and it got triggered again by someone mentioning it,
So clearly, though, you've got an open-mindedness. I mean, that must be part of your character. It's not just seeing that one wound heal quickly. It's got to be the combination of seeing that as well as that inquiring mind and being open to all possibilities. So you clearly do have an open personality.
Well, I would argue.
Okay.
I would argue that the medical training teaches us. I'm a trained observer. I'm a trained observer. We analyse, we diagnose, we collate a lot of information, we put it together, and seeing that something beyond normal had happened, like literally the knots, the suture knots, were covered in skin. Like the nurse had to pick the skin off, the new skin off the knots of these sutures in order to remove them 7 days after. That was just so unusual. So I suppose it's a curiosity, and it's also, I think, I thought, well, if there's a faster, more effective, or there's some boost that patients can be using, I want to know about it.
Right.
Because I want to help people.
Right.
That's what I do. Yeah.
Some of the herbs have been like that too. I remember that as a warning with herbs like calendula. They're just saying make sure that the wound's pretty clean before you start applying calendula as a mother tincture, not even as a homeopathic, because the wound healing will be so quick and so thorough that if the wound isn't properly healed, you could be in a little bit of trouble afterwards. So then, what happened next? Then what took you from interested observer into now a homeopath? Take me through the steps.
Well, when I came across, the nurse in the rest home that I was visiting mentioned homeopathy and that she was studying, I just happened to be in a stage where I was changing jobs from work less hours in a new practice in the city, and the training was in the city. So I saw that I could do that, which was like a weekend training. So that's how I enrolled. So I just was like, I don't know, there was no question. It was that if there's this safe, easily accessible method that people can be using alongside orthodox medicine, I wanted to know about it. So I enrolled, and I wasn't the only doctor. There were actually 2 other doctors who enrolled in the same year. So that was quite interesting.
So that's interesting in itself, though, what you're saying about how you wanted something that could work in conjunction with conventional medicine, because so many homeopaths are absolutely confirmed in their belief that you've got to make a choice between one or the other. Like antibiotics will antidote a remedy that's being given, or steroids will antidote a remedy that's being given. So what are your thoughts on that, having experience in both sides?
I've never observed that in practice, in clinical practice, and I've been, over from 2003 when I graduated with my homeopathic diploma until I suppose I was working in a different setting at different times, but for over how much is that? I don't know, 17, 18 years, whatever. I was using homeopathic remedies, acutely, particularly alongside orthodox treatment. And what I observed was synergy, in my experience. So you'd often need less of the orthodox medication, a shorter course, and the patients would judge themselves that they'd take their remedy away. And if the remedy worked very effectively, very quickly, they sometimes wouldn't need to take their backup prescription. But I always made sure that people knew you must take this prescription and take some homeopathy alongside to see if that helps, and that they also knew that. Or alternatively, I might say, look, if you're happy to try the remedy first. If you're not progressing, then you can move on to the prescription. Because people need options. So synergistic is what I observed, literally.
It's an interesting thing you say that, because as you know, I deal with a lot of pandas kids, and a lot of those kids are doing treatments like IVIG, etc. Now, one of the things that I've found, though, is that they could be on their third or fourth dose course of IVIG, and when I ask the parents, what's been going on, because it can be a little bit of a toss of the coin whether or not it makes things better or worse, but a lot of time it has no effect whatsoever. But this is what brings me back to this synergistic thing that you're talking about, because I've also had, I don't know what percentage of cases, but enough for memory that if I get onto that right remedy quickly enough, then the next IVIG treatment is a lot more effective. So it's almost as if they've been in a place that's too dulled or too unresponsive even for the conventional treatment, and now they're almost in a sparkier place. They're almost energized to a point where they can accept the conventional treatment, and the conventional treatment seems to work quite well, whereas before it was, they were dulled and it didn't seem to do anything. Have you noticed anything like that?
Particularly with people undergoing conventional medical treatments that come with relatively high probability of adverse effects and side effects. I have particularly found homeopathy useful at mitigating those effects. So, I certainly can't say it's across the board, but I've had patients that were prepared to self-manage homeopathic remedies through chemotherapy and
that's
radiotherapy,
the one I thought of too,
particularly, and some of the feedback has been the doctors couldn't understand that I didn't have to take the pills, because in medicine we'll often prescribe pills to mitigate the side effects of the therapy. Which is perfectly reasonable if you don't have an alternative. But if there's an alternative that's effective for people, I think I prefer to let them use it if they're willing and interested.
It's interesting that you went straight to the chemo and the radiation, because that's exactly what I was thinking too, that the use of homeopathy there nullifies a lot of those negatives, the nauseas, the pains, even some of the, things like a lot of plantar fasciitis that a lot of people seem to get afterwards, and some sort of rheumatic type things. If they're on the right remedy, they don't seem to get any of that. In fact, they seem to breeze through really well. And I'm not suggesting that the homeopathy is the replacement for it, but when we're talking about the topic of synergy, then it does seem to be extremely complementary. I've never found what a lot of people speak about, that heavy conventional medical uses will negate homeopathy and it's all useless, so you need to choose one over the other. It's never been my experience.
No, and there's certainly times where the medical treatment is essential and it's life-saving and it's life-enhancing. But there's really no reason why something that is not going to interact or negate that treatment in any way, shape or form cannot be used in a complementary way alongside. And that's something that I've found that particularly the medical profession struggle. They often see it more as an alternative, and I've been advocating as for homeopathy to be complementary right from the word go, because that's where I see it belongs.
So what do you think are... We've spoken a little bit about homeopaths' objections to conventional medicine because they're under the belief that it will negate what they do and therefore it's a bit of a waste of time. What do you think are the primary negative outlooks from conventional medicine towards homeopathy?
I think it's based on lack of knowledge, lack of understanding, and lack of experience. And the biggest issue is that many, I can't say almost all, but many medical doctors either fail to understand that homeopathy is giving non-material doses, so it's energetically based, and therefore there's no potential for any toxicity or interaction. Or if they do so, they assume that homeopathy cannot be effective, or that it's implausible on the basis that it is non-material, because they are somewhat anchored and restricted in that material, therapeutic, and medical interventionist type thinking.
So it's almost the preconceived notion that homeopathy shouldn't work,
yes,
rather than
yes,
whether it does or doesn't work.
Yes, and of course I didn't consciously have that. I was, wow, that's an amazing result. How did that happen? Because for that particular patient, I had said to her, I need to give you some antibiotics to take because there's a high probability that will get infected. And she said, no thanks, I don't need it. And I had no idea why until 7 days later.
So the strengths of homeopathy are that, particularly constitutional homeopathy, is that the whole basis of a constitution is that, and something that's probably lacking in modern day conventional medicine, is that it acts like a tonic. It builds you up, that whole sort of lift in your health and vitality, and as a result of that improved health and vitality must mean that you are healthier by nature. But from again, studying, being able to comprehensively look at both systems, what do you think are the weaknesses of homeopathy?
Look, I think the weaknesses is the lack of accurate, easily accessible, consistent information that's being disseminated. There's so much diversity. There's so many different perspectives on homeopathy that homeopaths aren't and haven't been really, in my experience, presenting a united, picture or presentation of homeopathy. And I think that's a big problem. And I think that because when I do have encounter doctors or nurses, other health professionals that are interested, they'll often say, well, tell me about it or whatever. And I mean, it's not something I can tell them in 5 minutes, which is how I came to write that book. So I ended up writing a book originally.
Tell for people that are interested, the title.
So the title is Medicine with Meaning. Subtitle is A Doctor Discovers the Healing Power of Homeopathy. Because of course I had to put my story in there. I decided that because for me there's nothing incomprehensible. It was completely real that I discovered that you can use that homeopathy can be effective and safe, and that doesn't negate conventional medicine in any way. Conventional medicine can be effective and safe and often necessary. And that doesn't negate homeopathy in any way. But there seems to be this idea of mutual exclusivity between the two. And I did a lot of reading and a lot of research before I actually sat down and wrote the book. And a lot of what I read from some quite well-published homeopaths was that their perspective was that it was an either-or situation. And that's why I presented in my book, even on the cover, there's two hands. One's holding out some pilules, the other hand's are gloved, medical with the stethoscope. And for those, if these two completely different perspectives on health improvement can coexist in me and be integrated in me, they can be integrated. They can be integrated in other people and in the community. And really homeopathy can return to its rightful place It's my goal, a lofty goal, alongside orthodox medicine.
So why has it fallen, do you think, in your mind?
Well, I think the lack of a unified explanation of homeopathy, a lack of information. I also think that, and particularly in these times, what I hear from my medical colleagues and what I certainly have experienced when I was working as a registered doctor, we're so busy and so overwhelmed by all of the updates, the new medications, the new protocols, the new systems, the new diseases, including the recent pandemic, that to investigate outside that square takes a lot of motivation. And a lot of there's time and energy. So the way the current system is set up, it's not conducive.
No, and I can understand that. I understand that even just in my own clinic, and GPs are probably busier than what I am. But I mean, they will. It takes me all my time to just manage my own, to learn the different remedies, it's to learn another system as well that you're not even going to practice in most of the time. It's really just out of your knowledge and general interest. But there's 24 hours in a day, and 8 of them should be spent sleeping. So, you know, it really just does come down to time. So if you're talking about a lack of unification, which to some degree in homeopathy, excuse me, is understandable, because essentially we've got a process that's relied on individualisation, and of course practitioners will say, well, there's that extends to practitioners, because you know, in order to get the simillimum that you're looking for to achieve individualisation, that process is as individualised as the people that you're treating, which can also be, as you pointed out, its greatest weakness, because there's no unification whatsoever. So what can homeopathy do, in your opinion, to unify itself a little bit more, or to create a more, I'll say a unified impression?
Well, I think joining forces, I think being part of a homeopathic community, finding ways of getting information out there, and like, for example, in New Zealand, we have the New Zealand Council of Homeopaths, which is our registration body, and that's a way of bringing those diverse homeopaths together under one umbrella, and sharing knowledge and experience and presenting what we do to the community. I think the thing that perhaps holds most homeopaths back, which probably doesn't hold me back, fortunately, is fear of ridicule.
Right.
And fear of ridicule, fear of being, what's the word? Fear of being put down, dismissed. There's a lot of fear, because there's a whole history, I suppose, where homeopathy and allopathic medicine, or, you know, conventional medicine is probably the word to use, there's been some conflict there. And I think, you know, given that most doctors are just too busy, I think the way in for homeopathy to the medical and health professions is through the patients reporting and sharing their stories with those people. So the patients who are getting, they can give the feedback, they can share the stories, because that's, I mean, it was the patient using the homeopathy that caught my eye. I think I'd like to see more of that. But what I do hear from patients is, because I ask all of my homeopathic clients and patients, would they like me to communicate with their regular family doctor to let them know they're having homeopathy with me, my contact details, what homeopathy is, and just some information about it for safety and reassurance. Now, while many patients are happy for me to do that, depending on their relationship with their doctor and how open they are, there are certainly a number of patients that don't want that to be shared because they're concerned it will actually impact on their medical care and their relationship.
And they're afraid of being ridiculed too.
Exactly.
Yeah.
Exactly. So I think look, I'd like to see the medical profession as a whole sticking to what they know, sticking to what they know and do well, their knowledge base, and letting homeopaths just do what we do, and not be threatened, not be, but to be reassured that homeopathy is safe. And we need to get that out there because a lot of people, health professionals, medical doctors often think that homeopathy contains toxic substances, high doses of herbs that it can interact with their treatments, and that's not true. So I think also the international, there are global communities and associations, and in New Zealand we have the Homeopathic Society, who are working with the New Zealand Council of Homeopaths to get more information out to the public. I think that's great.
Yeah, no, and I do too. It's and I agree with you 100% on that. So when we talk about homeopathy, obviously we're speaking to each other because we're talking about that very specific branch of homeopathy of HFA, which is yet another faction, I suppose, which so on the one hand it sounds strange that we're talking about how we're not unified, but then on the other hand we're talking about how we practice our own way. What and honestly I don't want any sort of pat. This is not meant to be a pat on the back sort of question for me. But what led you to this system, and what is it that you like about this system?
Well, what led me to the system was a series of coincidences where I just happened to be reading an old article, and somehow homeopathic facial analysis had escaped my awareness for a number of years, and I think it was just being a busy doctor was probably the reason for that, and also I've worked with other different methods of homeopathy and had results, but not felt really confident about reproducing and maintaining those results. And so I think really as a trained observer, and doctors, we observe, we take the history, we examine people, and this is a method where you actually examine the person, you examine their face. Now you don't do that face to face; you do it using photos, of course. But for me to have an investigation tool, an assessment tool that can be analysed, like learnt, practiced, hopefully mastered, and then applied, that narrows down the choice of homeopathic remedies for each individual. That was just extraordinary. And the other thing I found extraordinary is that the basis of facial analysis is the three directions of energy movement, and I have already spent a lot of time trying to understand how and why does homeopathy work, because I'd seen it work so effectively. And I'd given that a lot of thought, and I could see that in your method, you'd given it a lot of thought, and you'd come up with this system which actually literally explained the philosophy behind the treatment of chronic diseases, and in medicine. We're always looking at individual people's, populations of people's, their predisposition to particular diseases, and homeopathic facial analysis delivers that. It gives you the predisposition. It makes sense. Facial analysis makes total sense of homeopathy for chronic and recurring conditions, and that's why I decided to investigate it, learn it, and I love it.
And it is a process. I mean, when we were talking earlier today, and Louise was saying that there were a lot of people that wanted to sort of say that, this should be called the Bentley method, or it should be called whatever, and I didn't want any part of that. And the reason why I did that is that I really do think that it's a process. It's a method that anyone can learn, and then once you do learn it, all you have to do is follow those steps. Now that doesn't mean that there's no subjectivity or there's no room for individualization. There's always that gut feel, but that gut feel has to be developed over time. I don't like this idea that my intuition just says that it should be 1, 2 and 3 when your intuition is based on about 3 months worth of experience. I do believe that people get gut feels as they go along. So I don't have any problem for that, and it does allow for that. It allows for that in the certainly in the case management too. I think that case management part, as we were speaking about earlier, that case management part is a very individualised process, knowing how somebody responds to a remedy, what you're going to do next, and that's based on a lot of experience. But the one thing about HFA, why I always wanted it to just, for me to be kept out of it and for it to just be just a system that someone else learns, is because I wanted people to run with it. I didn't want any of this sort of rubbishy, guru-y sort of thing. I just want people to pick it up, be able to do it, and maybe even teach it themselves. And it is transferable like that, because it is a process, as you know. It is about learning what to do step by step.
The thing that I find so appealing is you've literally developed a clinical tool. It's a clinical assessment tool. And in medicine, we use those all the time. We use them all the time. We use diagnostic criteria, we use algorithms, and it actually, because I express this as my opinion. My opinion is that homeopathy is medicine. I wrote the book, Medicine with Meaning. There's no bones about that. That is clear from me. As far as I'm concerned, homeopathy is medicine. It's just different to modern conventional medicine. And I suppose that, yes, to have this method, which is it's easy. It's actually relatively easy to use. Yeah, the rules are not difficult.
No, it isn't. I mean, nature's done all the work. We're just really observing it and putting it into practice. And I think that's right. You're absolutely right. When you've got to remember that homeopathy is a medicine. The very definition of medicine is to take somebody who's in a state of ill health into a state of health, and nothing is more health promoting, I believe, than homeopathy. Now, that doesn't mean that, sometimes conventional medicine and that sort of antipathic approach that they have isn't needed. It is really needed, as you know. I mean, the body can so easily go overboard to where its reaction to the illness needs to be tamed and calmed down, because it becomes worse than the actual illness itself. I mean, febrile convulsions and things like that are just quick examples of that. But the one thing that I think that homeopathy still has over, say, conventional medicine is still the idea of the constitution. I think the fact that conventional medicine does not account for the constitution. I think it's its loss.
Not at all. Not at all. And that's I suppose that's because there's elements of the constitution that are the non-physical. It's a vitality.
Yeah.
In homeopathy, of course, it's the vital force.
Yeah.
And one of the key things about the medical system is that there is no acknowledgement of the vital force, our energy body.
Yeah.
That's something extraordinary that's missing, and it's present in all other healing modalities.
Yeah.
Yeah.
And in fact, you could argue that the notion of the Constitution is the one unifying factor of most alternative therapies, whether it be, acupuncture, chiropractic, whatever it may be. Those type of alternative therapies, those a little more sophisticated, dare I say, alternative therapies, they all have the Constitution at their base. Essentially, the healthier you can be, the better you're going to be. And it's a concept that, while really simple, is very hard to argue against. So how can you argue against its accuracy or the truth of being that the happier and healthier you are, the better your life's going to be? Okay. All right. Well, look, it was lovely to speak with you. And unless there's anything else you'd like to say or ask, if not, we'll call it quits.
No, it's been a pleasure. Thank you very much, Grant.
It's my pleasure, Sandy.
Okay.
Lovely.
Okay.
All right. Well, thank you, everybody. And we'll catch up with you next time. Bye-bye.
Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.